Greetings everyone. I am Dr. Ketan Barjatia, fifth year DRNB Neurosurgery resident at Aster CMI Hospital, Bangalore. And today I will be discussing surgical management of intracerebral hemorrhage. Spontaneous intracerebral hemorrhage or ICH remains one of the most challenging neurosurgical emergencies. While many patients are managed conservatively, surgery plays a crucial role in selected cases to reduce mass effect, control intracranial pressure, and to prevent secondary brain injury. The decision for surgery depends on hematoma location, volume, neurological status, and presence of mass effect and hydrocephalus. The most widely used technique is open craniotomy with hematoma evacuation. This approach is particularly considered in lobar hematomas, especially when the hematoma volumes exceed 30 to 40 ml, when there is a significant mass effect, or when patients show neurological deterioration. The goal is decompression and removal of clot to reduce the intracranial pressure. However, outcomes with conventional craniotomy in deep-seated hemorrhage, such as those involving the basal ganglia or thalamus, have been variable. Because of this, minimally invasive surgical techniques have gained increasing interest. These include stereotactic catheter placement with thrombolytic clot evacuation, as well as endoscopic evacuation of hematoma through a small cortical corridor. These approaches aim to reduce surgical trauma while achieving effective clot removal. Another important neurosurgical intervention is external ventricular drainage. In patients with intraventricular hemorrhage leading to obstructive hydrocephalus, placement of an external ventricular drain allows cerebrospinal fluid diversion and intracranial pressure monitoring. For patients with massive hemispheric hemorrhage and refractory intracranial hypertension, decompressive hemicraniectomy with or without clot evacuation may be considered as a life-saving procedure. Current evidence suggests that the patient selection and the timing of surgery are critical. Early intervention in appropriately selected patient may improve neurological outcomes, particularly when the mass effect and neurological deterioration are present. In summary, surgical management of intracerebral hemorrhage includes open craniotomy, minimally invasive clot evacuation techniques, ventricular drainage for hydrocephalus, and decompressive craniectomy in malignant cases. Understanding the indications and timing of this procedure is essential for optimizing outcomes in patients with spontaneous intracerebral hemorrhage.